Another potential 2020 Democratic presidential contender, South Bend, Indiana Mayor Pete Buttigieg. Mayor, I'll ask you the same question. Were you surprised at all by the move by the Department of Justice, which is fairly irregular, or the timing to go full in on calling for the ACA to be entirely struck down?
As a matter of policy, I'm not surprised because this seems to be the position they hold deep down. Just take this health care coverage away from millions of Americans. As a matter of political strategy, I'm a little bit surprised because, most Americans want this. And so at this moment when they were going to take a victory lap around what was happening in Washington, suddenly they're reminding us why so many of us are Democrats. One thing I've been thinking about is the amazing shift between 2010, when I was a young nominee for state treasurer, and watching as a Democrat on the ticket how we were getting absolutely beat up. I mean, healthcare, the ACA
destroyed.
Was a toxic issue for Democrats. And then by 2018, it was the winning issue for Democrats. What happened in those years? Well, it's very simple. The bill was actually implemented, and people liked it. Back in 2010, they're talking about all these theoretical things that might be, like death panels. By 2018, in the town halls that happened then, you had regular Americans getting in the faces of members of Congress saying, this is what this bill has done to make my life better. And it turns out it's just harder to lie to somebody about their everyday life. So the idea that they would want to do this is a little strange to me politically. But again, this is their policy. They call themselves I'm mystified that the president thinks this will help them become the party of healthcare. I don't know how you can become the party of healthcare when you're now making it abundantly clear that your position on healthcare is to take it away from millions of Americans.
It's interesting you bring up that 2010 race in which you were running statewide on, for treasurer and lost that race. There's two ways to think about that, right? So one is that people didn't know what it was and they saw Obamacare and liked it. The other is that voters are extremely risk averse with respect to health care, no matter what, right? They don't like changes and they are worried about it. And how much does that factor into your thinking about where the healthcare system should go next?
Well, it's one reason that I think the glide path toward a Medicare for all or single-payer environment should be what I would call Medicare for all who want it. Not just because it might be easier for people to swallow, but also just practically. Any politician who goes around raising hopes about Medicare for all, and I believe in Medicare for all, but any of us who allows those words to escape our lips ought to have a very credible, very clear path and plan about how we're supposed to get from here to there. The way I would do it would be to take a version of Medicare, make it available on the exchanges as a kind of public option, and then if people like me are right that this is not only going to be more widespread coverage, but also better, more cost-effective than this corporate patchwork system we have now, then people are going to very quickly gravitate toward it.
I've heard that argument, and I've heard a number of people, Kirsten Gillibrand the other day in a town hall making a similar argument. They saw that as a glide path. But if you're right, and if Kirsten Gillibrand is right and others who support this plan are right, won't the health insurance industry fight that just as hard as they would fight just outright Medicare for all if they know that's eventually where it's going to go?
Well, if they fight it by actually coming up with something better, that would be nice, but that's not what we're seeing. We have a system now that is better than the system 10 years ago, but still not good enough. Too many Americans are underinsured, and the system is just unbelievably inefficient. We're paying more for worse outcomes. So, of course, they're going to fight it. From a profitability perspective, I think they're making a lot off the status quo. But if it's the right thing to do, if most Americans get that it's the right thing to do, then we should find the courage of our convictions and go out there and talk about it, especially when this is not a matter of competing plans. It's a bit like climate, and they're picking on the Green New Deal framework. But it's not the Democratic plan versus the Republican plan. It's the Democratic plan versus no plan at all.
You've been the mayor of South Bend now for, I think this is your 8th year, if I'm not mistaken. Mm-hmm. It's a relatively small city. It's considerably smaller than my home borough of the Bronx. The U.S. healthcare system is 330 million people, inordinately complex, far more complex than I can get my arms around. Why should someone trust that you, with the experience you have, would be able to actually navigate the complexities of that system?
Because we need leadership that speaks for the communities, including industrial Midwestern communities like mine, and for that matter, rural communities that have felt left out of the process politically and policy-wise for a long time. I'm not applying to be the director of CMS. I'm talking about the political leadership that is needed in this country and in this party in order to move us out of the situation we've been in. And I would argue that a mayor of a city of any size, especially in the strong mayor system we have here in South Bend, somebody who has to alternate hour by hour from dealing with an economic development puzzle to responding to a racially sensitive officer-involved shooting, has skills that are certainly a lot more relevant than the current president's skills, but also, I would argue, no less relevant than even a senior member of the Senate who perhaps has never in their lives managed more than 100 people.
I want to ask you a slightly off-topic question. I've been reading these anecdotal accounts of your language ability. You speak, if I'm not mistaken, French, Italian, Spanish, Arabic, Dari, and Maltese. Your father's Maltese, so that was early on. You taught yourself to speak Norwegian because you liked a Norwegian book. I don't believe that, or I am not sure. Like, is this actually true? Like, what level of proficiency are we talking here, or is this like hello, goodbye, good morning, good night?
Yeah, I'm not going to claim to be fluent in these languages, especially because it's been a while since I've had a chance to practice most of them. I think
we have native speakers behind me in all of them. We're actually going to run a test here, so.
No, let's do it. We could try it. I can read a newspaper article in Italian. I can do, in a halting way, I can do interviews in Spanish here on our Spanish language radio station. Norwegian news crew, I guess, heard that story and came to interview me in South Carolina. We lasted a little while before I kind of ran out of Norwegian because I wasn't expecting it. But look, I'm not selling myself as a linguistic genius. I do think it's not a bad thing for us to have leaders who are curious about other parts of the world, who've taken the time to learn other languages and learn about other cultures, especially knowing that America is going to have a lot of work to do to reestablish our credibility in the rest of the world.
I couldn't agree more. Anyone that can speak more than one, I am in awe of. Pete Buttigieg, thank you so much for your time tonight.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.